Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Here's Eddie Frederick.
So glad you can join us. A further 90 days extension for Trinidad and Tobago's state of emergency. This story takes the lead in our 1118th edition of Caribbean Perspective for Monday 24th May 2021. Details after this break.
Hubbard's big promotion is back. Live free for 1 year. Spend $50 or more in any Hubbard's department and receive a chance to win big prizes every month. Property or vehicle insurance for 1 year. Free internet, cable and data for 1 year. Free fuel for 1 year. Free cooking gas for 1 year. Free electricity for 1 year. Free drinks for 1 year. Extra cash account and the big free groceries for 1 year. Promotion runs from April 1st to September 30th, 2021. Live free for 1 year with Hubbard's in association with Solgas, Flow, Grenadian General Insurance, Carib Brewery, Coca-Cola, Grenada Bottling Company, Grenlec, Communal Cooperative Credit Union, Dutch Lady Milk, Promo, Danny and Supreme. Terms and conditions apply.
Welcome back. The state of emergency in Trinidad and Tobago is being extended by 3 months, but it doesn't mean that's how long the present lockdown would last. The Prime Minister cleared the air on that, but also highlighted what he believes is disturbing behavior. Here is TV6's Alicia Boucher with the details.
July 4th is the date earmarked for the present public health regulations to remain in effect. Prime Minister Dr. Keith Rowley says it would enable the necessary actions needed to combat the spread of the virus, such as mask wearing and quarantine, to continue to be enforced. But he's clearing up what might be misconceptions in the public domain concerning the state of emergency.
When we go to the Parliament tomorrow, we will take the 90 days that the law allows, but it doesn't mean that we are going to be in this situation for 90 days. We will revoke it as soon as that is the prudent action to take. Whether it is 1 month after, 6 weeks after, or whatever time we'll want to come out of it as quickly as possible.
According to the Prime Minister, the same applies to the public health regulations, as he cites that May 23rd was the initial marker government was looking at for relaxation under the present lockdown.
The date has been reached, but the expected condition has not been attained, and in fact it has worsened. So we are now looking further down the road. So what we're really looking at here now, as of today, I can tell you, we're looking at 4th of July. That's in place now for the public health regulations, and of course the 90 days for the conditions of the state of emergency.
You might question why the condition has worsened since the country has been under an SOE for a week now. Well, for one, the Prime Minister says people are still not obeying the public health protocols the way they should.
If your mask is not covering your nose and your mouth, particularly your nose, you are not masked. Having a mask hooked onto your ears and under your chin. And I tell you this because the reports that we are receiving and which we are seeing is that a large number of people are still not masked.
In fact, over a 24-hour period between Friday and Saturday, police ticketed 91 people for not wearing face masks. According to the director of the Epidemiological Division, Dr. Avery Hines, the high number of cases that were recorded mid-May is possibly a result of the last-minute rush that occurred before the lockdown. He says based on the data, the caseload at this time falls slightly below what was projected, and some progress, though small, might be on the horizon.
Bars towards the right-hand end, which are currently shorter, we're still making sure that all the information has come out of the system relating to cases swabbed on those days, but they do seem to be a little shorter. We're hoping that as the rest of the data comes in, we begin to see something of a downward trend, but we can't say that we're seeing that just yet.
As it relates to the overall hospital occupancy, Principal Medical Officer of Institutions, Dr. Miriam Abdul-Richards says, as at Saturday morning, it was at 70% if taking both islands into account. But she notes that beds have been added to the system, resulting in what appears to be a decline in occupancy on paper. And she's urging the public not to allow complacency because of that.
Our resources continue to be strained. We are moving doctors, nurses, and ventilators between hospitals based on demands. The population needs to be reminded that as a country, we need to be reminded that the only way to reduce the supply side of this equation and to really win this war against COVID-19 would be to continue practicing the 3 W's.
Alicia Boucher, TV6 News.
You're listening to Caribbean Perspective with Eddie Frederick.
Still on TNT, the Prime Minister there, Dr. Keith Rowley, is sending a message to people who he believes are attempting to cast a shadow of doubt over the healthcare system. In highlighting 2 recent incidents, including the transfer of medical staff at Couva, the Prime Minister is calling for politics to be kept off the wards of the nation's hospitals. Alicia Boucher again of TV6 News reports.
At the United National Congress Forum on Monday night, opposition leader Kamla Persad-Bissessar made mention of a letter she received, saying it indicated that persons were being denied treatment and subsequently dying, highlighting the case of an 86-year-old man.
Using our government's reporting language, he was an elderly male with comorbidities. So we knew his odds were against him. Your dad is very sick, and because of his age, he does not qualify for ICU. Here's a patient that needs the ICU, but he doesn't qualify. You know why? Because he's only going to die anyhow. Isn't that what that implies? Your dad is very sick, and because of his age, he does not qualify for ICU. The system is overrun, and because of the government's profile, he was not a candidate for further treatment.
Calling that statement painful, Prime Minister Rowley says, as it relates to the administration of healthcare, government has no control over the decisions of medical professionals.
Doctors in the hospital in Trinidad and Tobago are under no instruction or direction as to how to act when patients report to them and present clinically. Public policy on these matters are known. But with respect to care of individuals within the institutions, that is not true.
Dr. Rowley says Persad-Bissessar's remark has caused aspersions to be cast on the frontline medical staff, which has been up front and center in the heat of the pandemic and deserves to be thanked at this time. The Prime Minister states that senior citizens are among those most fearful for their lives under the serious COVID-19 circumstances, and he's giving them this assurance.
We will do everything that is feasible for the government to do and pay what has to be paid as long as we can afford it to ensure that you enjoy every day of the life that you can have that God has given you. So please ignore that. As if that wasn't bad enough, a few days later, from the political arena again, we are now hearing that doctors in the hospital are being moved around because of political victimization.
And that, he says, brings into question the credibility of the hospital's management.
So today, I want to ask whoever is doing it, stay out of the hospitalization program in Trinidad and Tobago. If those kinds of arguments that are being fostered now about the behavior of our professional staff, if they are allowed to take root, that politicians could give instructions to our professional staff who have distinguished themselves publicly. When it takes root in this country, when that cancer begins to grow in this country, it will not be able to be prevented from being metastasized. Keep the politics out of the hospital wards.
Alicia Boucher, TV6 News.
Major upgrades are on the cards for Barbados' fish markets as part of the government's plans to modernize the sector. More in this Barbados Today online news item.
Vice President Dr. Barra Jagdeo on Friday expressed concern with the crime situation in the country, assuring that the government has taken steps to tackle the problem that has caused disquiet among citizens. During a press conference at the Ortochang Conference Center, Dr. Jagdeo said there is a plan being rolled out to tackle crime. Providing brief details on the plan, Dr. Jagdev said the government was looking at resuscitating and expanding the Smart City Surveillance Program, which will allow for the recording of activities in several areas across the country that will be monitored through a command center.
Resuscitating the Smart City Program because it's all in chaos and it's limited to 265 cameras, but taking this across the country and with a capability of monitoring and operating it so you can see what's going on. It would help a lot. That means we'd have to pass new laws about privacy, etc., but it's a law enforcement tool that would be crucial in managing, etc.
The Vice President also said that the government intends to ensure that the local forensic laboratory at Turkine East Coast Demerara is fully staffed to support the police, offering a boost to its investigative capabilities.
Guyana's Vice President, Dr. Barath Jagdeo, on Friday rolled out new plans to stem rising crime levels in that South American country. More from News Source Guyana.
In other news this Friday, major upgrades are on the cards for the island's fish markets as part of government's plan to modernize the sector. Word of this from Minister of Maritime Affairs and Blue Economy, Kurt Humphrey, at today's official opening of the Pearl Bay Fish Landing Facility. The new facility at Tent Bay provides access for disabled persons, a green space, photovoltaic panels on the newly constructed building, and proper lighting that will not attract turtles into the road.
So if you look at all of the markets, starting from Tent Bay, we renovated Tent Bay. We came down to Oistins, we renovated Oistins. We came to Bridgetown, renovated Bridgetown. Here we are now at Pearl Bay, renovating Pearl Bay. We've also done Spikestown. You've just heard the chairman say we are about to do Western. The ministry will do Paynes Bay and Concept Bay. That will be all of the fisheries departments under the ministry in the period of 3 years. So I say that to say that we have made a commitment to transform the industry and we have put our money where our mouths are.
Prime Minister Mia Mottley says our government is committed to facilitating the growth of the fishery sector.
It is why almost every fish market has been attended to as a priority by this government. It is why we have gone to Parliament late last year to get the money to do the fishing, the FADs, the fish aggregation devices, a lot of fancy words for a simple thing that is a piece of metal in the sea that the fish can come round. But the beauty of it, that by putting it there, it means that men don't have to waste diesel looking for where the fish gathering, because we are creating opportunities for the fish to gather in a particular space. And I believe we've done 20 of them that are being put around the entire jurisdiction of this maritime jurisdiction of this nation. In addition to that, you heard Kirk talk about the phytosanitary measures. This country has been unable to export fish to Europe because of a failure to be able to have the appropriate standards in our fish markets and the legislative framework. We have been working assiduously, as you've heard, to put those appropriate standards in place, and we are also working assiduously to get the legislation in place so that our fishermen can sustainably and responsibly fish.
Did you know that your friends and family can now shop at the Food Fair from anywhere in the world, and you can receive here in Grenada? The Food Fair and GrenadaMarket.com now make it possible through secure online shopping and personalized customer service. Simply send your loved ones a list of your preferred items or let them fill an online basket, and the items will be available for pickup or delivery. Visit GrenadaMarket.com or thefoodfair.gd today for more details. The new norm. Spread the news.
I am Eddie Frederick. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.